Hello! On today's video, we are going to be doing some exercises that I already have demonstrated some of the upper extremity zone that we do for the abs and the pelvic floor. And now I'm going to show the combination of the lower extremity zone that you can go into a progression and combine your upper extremity zone exercises. It's pretty much kind of isolating some of the major groups of the upper extremity or some of the major groups of the lower extremity and combining them and making it to a little bit more complex movement to allow you to do a more efficient exercise and in a very short period, and at the same time raising your heart rate and allowing you to burn calories on a short period. And more important than that is actually helping you to mimic some of the activities that we do on a daily basis, like lifting, picking something up, putting something on the shelf, lowering yourself to the ground. So those are the activities that we do it. And this set of exercises that I call the lower extremity zone exercises, it mimics those functional activities. So it's a very functional way of gaining your strength and carrying over to activities that you do on a daily basis. Okay, for the exercise, you are pretty much going to need some light weights, 2 or 3 pounds. We don't want to overload the upper body. We want to just be able to do some toning of the arms, and then we're going to be focusing on maintaining the transverse abdominis engaged the whole time while we are practicing those functional strengthening with the lower extremity zone in combination with the upper extremity zone. Just in review, on the upper extremity zone that we did it, the exercise on the Swiss ball, we did it the biceps curls in the sitting position, right? We did it the flies in the sitting position as well. We did the military press, which mimics putting something on the top of the shelf. And we did the tricep extension because all women want to have nice, good toned muscles in their arms. And then we did the punches above the head with a little gentle the trunk twist, punches at the shoulder level, and then punches down to the low level, the hip level. That's the upper extremity zone that we did it on the previous video with the Swiss ball. Today we're going to combine the both of them with the lower extremity. So you know what you're getting yourself into it. The lower extremity zone includes pretty much normal stance squat, and either squatting down, the abs are in. That's one of them. The second one is lunge dips, and you do, of course, both sides. And we do the wide stance with the weight shifting right and left. And we're going to be doing also side steps or forward lunges. And wide stance horse stance with the wide squat. And the single leg balance that you can combine that as well. Okay? All right. If you're ready, grab your weights. Take a deep breath, and we're going to start with the combination. So normal stance, abs in, arms to the side, and you're going to squat it down and bring it up. And 2, 3, 4, 5, 6, 7, 8, 9, and 10. We'll continue with the squats. Squat it down, up, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Maintains the abs in. We're gonna do triceps extension, 2, 3, 4, 5, and anytime you should not be having pain on any part of the body, maybe some muscle fatigues, 9 and 10, and flies. No shoulder pain, no knee pain. And 3, abs in. 4, 5, 6, 7, 8, 9, and 10. That was the first. So we did 40 squats and 10 repetitions of your arm exercises of the whole series of the 4. Okay? All right. The next one is going to be the weight shifting. We're going to do the punches above the head. Okay? So you're going to shift your weight to the right, twist your trunk and punch, and punch. 2, abs stays in the whole time. And 4, 5, 6, 7, 8, 9. Keep the shifting. You're going to go down shoulder level. 2, 3, abs in the whole time. 4, 5, 6, 7, 8, 9, and 10. Good. Wide stance, squats down with the low punch. And 3, and 4. I'm not doing this. This is not we're doing. Nice and tall. 7, and twist and punch, punch, punch. 7, 8, 9, and 10. There you go. That's the whole first set of your upper extremity zone, and with the combination of the lower extremity zone. And the variation you can do, you can mix and match just any of those movements for you to exercise. Alrighty? I'm huffing and puffing, yes, because that's what shows a proper breathing with the movement, and that's a good pace for me. If this is too fast for you, you slow down, or keep up and then get used to the motions a little bit more, okay? In between the sets for your arms, I like doing a little bit what I call the standing crunches. So we start with the arms up in here, and you just go with high knee marching with the little trunk twist. The abs stays in the whole time, and you just get the upper body going. If this is gonna get you your heart rate elevated a little bit more, it's 5, and you're gonna get a little bit of that standing work for your arms and legs, as well your abs. And 9, and 10. Good. The second set, I'm gonna mix a little bit more of the motion, okay? All right, now we're gonna go with your lunge dips for the first 4 of the arms, and we're gonna alternate the legs. One leg forward, one leg back, and we are dipping straight down. You can see on the reflection image how your shoulder stays in here. I'm not leaning here, and I'm not leaning like that. So hips over shoulder, all right? So biceps curls up. 1, 2, and you can make it as deep as you want it to be, or as shallow as it needs to be. No knee pain with this. 6, 7, 8, 9, abs in the whole time. 10, switch legs, switch arms, dips on your left. Now on the other side, dip down, raise your arm, flies. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Switch legs, switch arm movements. We're gonna do fly, military press, dip, up on the shelf, abs in. 2, 3. The arms is slightly going in front of you, not above your head, like you're putting something in the shelf. 7, 8, 9, and 10. Switch legs. Again, doing the triceps extension. Elbow stays forward. Dip down. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Beautiful. We're gonna go in the white horse stance, straight punching down. So you're gonna go punch, twist, and punch, abs in. 2, and 3, and 4, and 5, 6, 7, 8, 9, and 10. Good. Weight shifting punch, middle level. 1, 2, 3, 4, 5, 6. And you can look where your arm goes, or you can look straight ahead and work a little bit of that stiffness on the neck. 8, 9, and 10. Now above the head, I'm gonna do punch and come back, punch and come back. Or you could stay with the side shifting and do the forward above the head, punch and twisting. 3, 4. This is a long step lunge that I'm doing versus a lunge dip like on the other version. 6, 7, and if you notice, I'm losing the count quite often. It's quite challenging to be talking about motions and still keeping a perfect count. I can't do that. 9 and 10. Alrighty. We're gonna go back into the standing crunches, but this time we're gonna do continuous on one side. So you're gonna go into the waist shifting position, okay? Your arm's gonna lengthen in here. You're gonna bring your abs in first, and you're gonna bring your knee to the middle and crunch up, and 2, 3, and do a little bit this twisting. No pain anywhere. This should feel like a workout, not painful. 7, I believe is 7 again. 8, 9, and 10. Now we're gonna do the other side. Same thing. Crunch up, crunch up. 3, 4, 5, 6, 7, 8, 9, and 10. That is it. 2 sets of 10. Anytime you're exercising, make sure that you don't stop moving suddenly. You always stay moving, breathing in and out. That's your cooling down part of it. So you don't have feeling sickness, nausea, or feeling like you're gonna faint or anything like that. So just keep moving and breathing, feeling your heart rate to calm down, okay? And then as you calm down, you can go on with your other activities, okay? It's important for you to monitor your heart rate. I'm gonna get something in my back. Pause. So for your heart rate, there are different things out there. This is a pulse ox that it can help you to monitor heart rate. Of course, you can always use those strap bands. Those are the most accurate one that can allow you to show your level of exercise. But the pulse ox is very good and it's easy for you to just put in your finger and take your heart rate before you start doing the exercises and right after you finish your exercises. What you're looking for is pretty much about 10 to 15 beats per minute increase to your resting. If you have more than that, but you still don't feel like it's a lot of exertion, that's okay. That means you decondition, so your heart is feeling a little bit more on the load. As long as you feel good and you feel like the exertion is not too much, it is okay for you to have something more than 50 beats per minute, depending how old you are. And your physical therapist will guide you a little bit in that. But in general, there is a general formula out there for you to calculate your what level of exertion should be doing it, depending of your age. And it should, when you start any exercises, you will be ideal for you to do your work at 50% of your maximum heart rate. And the way to calculate the maximum of heart rate, you subtract your age from 220 beats per minute, and that would be your maximum heart rate. In my case, it's 220 minus 48. There would be nearly 50, so it's 170, 160, 72, right? That's my max heart rate. And if I was not fit and I was starting to exercise for the first time, I would do 50% of that. So it's 172, would be maybe a 90 at the most. It depends on where you rest. So if you rest, my rest heart rate usually is around 75. So I wouldn't be probably no more than 85 to 90 to begin with. And if you are feeling like it's not a lot of exertion, you can work to 60%. And you're still feeling not a lot of exertion, you work to 70% of your max heart rate. And then you can monitor how that. Your recovery is also very important. You want to keep in mind how fast you recover in between your repetitions, in between your work load, and then make sure that you recover to that resting heart rate. And so having something like this, like a pulse ox that gives you the heart rate and the oxygenation, it will tell you if you're breathing properly, first of all, because if you're not, the oxygen saturation will decrease. That means you're not breathing properly, or the exercise is too strenuous for you. And you will be able to monitor your heart rate a little bit more, okay? But that's it, the upper extremity zone combination with the lower extremity zone. This exercise, it will definitely help you to burn calories very well. It took 15 minutes for me to talk to you and explain everything and do the exercises. And I did a slightly fast pace. So if you think about it, it's only 15 minutes of exercise and you're burning pretty much about 100 calories on that 15 minutes if you're working at just 70% of your max heart rate. This is an average, right? It all depends how your metabolism is. But if you do this about 3 times in a week and you monitor your food intake, you will see a change in your scale. The most important thing that we talked about is to make sure that your abdominal muscles are engaged. And we talk about that with the Swiss ball. So this is the reminder about what it is that we talked about it. So I'm going to get a little bit closer to the camera so you can see when your abs are engaged or not, right? So here's me, the abs are engaged, and I'm going to let it go. So you can see a little bit of the pouch in there. My muscles are not engaged. And you definitely don't want to be here doing any of the exercises. You want to be a nice, tall posture. And you want to be able to draw the abdominals in and let it go. Draw it in and let it go. Draw it in. This is your abs in that I'm talking about, and keeping these abdominals engaged the whole time. So whenever you're doing your exercises, this stays in the whole time. When you're doing your standing exercises, your sitting exercises, your laying down exercises, every time you're doing strengthening with any part of your body, those abs should be going in all the time. In Pilates, that's called imprinting. In the gym world, it talks about engage your core, bring your muscles in, draw your navel to your spine. There's different words to describe this. My reminder for my patients, keep the abs in, keep the navel in, and hold it there. It should stay in the whole time because that will help you to maintain good posture. Alrighty? So you can start with 1 set of 10, 2 sets of 10, and then go up to 3 sets of 10 once you've been able to do 2 to 3 times a week well, and after 4 weeks that you're doing it 3 times a week, and you feel like you're not exerting yourself much, your heart rate is not going up as much, that's when you can actually try to increase, maybe to instead of doing sets of 10, sets of 12, or you increase the weight. I started with 3 pounds. When I started with 2. It took me about 3 months to do it and to progress to 3 pounds. And then I stayed for about 6 months to a year on the 3 pounds because I was doing very frequent. And in about 2 years after that, and then when I was able to go in and do 5 pounds, and I flared up quite a lot, so I kind of had to go back to do 3 to 5. I did not have a 4, and I didn't want to buy a 4. So I would do 2 or 3 or 5, and now I am consistently doing 5. I would say keep it light on the safe side. The last thing you want is to inflame these shoulder joints and feel like that you're not being able to do your usual activities because you overexert yourself and you create a little tendonitis on that muscles on your biceps tendon on your shoulders. Okay, do the exercises 2 to 3 times a week for several weeks. Don't rush into progression, rush into more, working to good form, and maintaining the abdominal muscles engaged. And then once you feel like it's not challenging anymore, and then you progress to something either by intensity, frequency, or repetition. So for today's all, and I hope you guys enjoyed the video, and I'll see you on the next one. Bye.